Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. We're an online virtual physiotherapy service treating people with Achilles problems. These can be tendinopathies or tendonitis, or indeed related to Achilles tears, ruptures, or what we're talking about in this video series, partial tears or partial ruptures. We've already covered in the videos what we might expect from the anatomy and what a partial rupture or partial tear means, what happens with healing repair and how long that takes, and what we can expect from a rehabilitation journey. This video is going to be talking about whether you may or may not need surgery. Now, the things to note with this is surgery for a partial Achilles tear or a partial Achilles rupture is really uncommon. It's really rare. Most of these get better by time and healing and the correct rehabilitation. What we're looking at is, are there any signs that anything has been missed here? So if you're thinking, I've tried some rehabilitation and I'm not quite getting where I want to get, have we missed something? So is there a diagnosis there that maybe an ultrasound scan could look at to check that it is still a partial rupture or a partial tear and there hasn't been a missed diagnosis of a total Achilles rupture? If you're lagging behind in that rehabilitation, has that rehabilitation suited you? Or is it a general tick the box, I've got a generic exercise sheet that somebody's given me or I've found on the internet, or I've read some exercises that somebody liked to do and I've tried those, but they haven't been made specific to your needs and how strong your muscle is and how robust your tendon is and where you are on the healing process, let alone what your genetics are like, what your age is like, what gender you are, and whether you have any other medical problems that could be delaying healing, for example. So there's a lot of things to consider. Surgery is a real last resort for a partial Achilles tear and a partial Achilles rupture, and it comes with a selection of things to think about. Anything where you're doing surgery to any part of the body where you are opening up with an incision, albeit quite small, has a mild infection risk that may come with it. Being more immobile after surgery to help things settle down and to help things to heal can also come with risks and complications such as deep vein thrombosis, which is like a blood clot, but there's lots of things medical practitioners do to try and prevent that if you are going to have surgery, and they give you advice or medication to try and prevent this too. It also means that your rehabilitation may start a little bit slow because we need the time for that surgery to heal, for everything to knit together. And at that point, as we spoke about in the previous videos about rehabilitation, you may be put in your heel being higher than your toe. So with wedges or wearing a certain specialist boot, or something which the surgeon has given you with a strict protocol onto how we lower your heel back down towards the floor in a certain number of weeks. It then goes back to that same rehab protocol with that same pyramid about getting you back to your sport that we spoke about in the last episode. So long and the short of it is, surgery can happen for an Achilles rupture. It comes out, if we look at the research, just as good as doing conservative management and exercises. So most times surgery is not necessary, and there are a few considerations to think about when you are considering whether you want surgery or not. 9 times out of 10, revisit that rehab. Has it been done well and consistently and been made progressively difficult? Have you as an individual been thought about and things been tailor-made to you? And have we respected that healing process, how long it might take to get better? Thank you very much for watching.